We continue chapter 17, the endocrine system, and now we are going to part 2. Here is your table of contents, and part 2 starts from the thyroid gland. Thyroid gland is located in the neck area, right under the larynx. That is your thyroid cartilage of the larynx. And here, wrapped around your trachea, there is a thyroid gland. It is made of 2 lobes. That's a right lobe and that's a left lateral lobe. They are connected by the structure called isthmus. Inside of the thyroid gland, if we look at it at the microscope, you will see structures called follicles. That's one follicle, another follicle, and those follicles, they are vesicles filled with substance called colloid. That colloid is made of a protein called thyroglobulin. It's a long chain protein called thyroglobulin, and molecules of iodine. So inside of those follicles there is a fluid called colloid, and it is the precursor of thyroid hormone. So thyroid gland uses that thyroglobulin and iodine to make thyroid hormones. Pay attention that amino acid called tyrosine is just a part, a building brick, building part of the thyroglobulin. Between those follicles and the cells surrounding those follicles are called follicular or follicle cells. But between them there are parafollicular cells, and parafollicular cells produce a different hormone called calcitonin, and that one regulates the amount of calcium in their blood. Thyroid hormone, or TH. There are 2 related thyroid hormones, 2 compounds, complex molecules. One of them is called thyroxine, or T4. It is made of 2 tyrosine molecules, 1 and 2, and 4 iodine atoms, 1, 2, 3, 4. So that is usually called T4, thyroxine. Another one, triiodthyronine, is made also of 2 tyrosine molecules, but only 3 atoms of iodine, and it is called T3. They have very similar action, and usually together they are called like one thyroid hormone. So right here, again, that is your follicle filled with colloid. The cells surrounding the follicle are called follicle cells, and that is blood vessel sitting very close to those follicle cells. The same picture you can see right here in your book. So that is a blood vessel. Those are follicle cells, one of them, and that is inside of the colloid, lumen. Okay, tyrosine is in the follicle lumen. Here it is, tyrosine attached to the long protein thyroglobulin. We receive iodide with food, and it's carried by the blood. So follicular cells take that iodide and turn it into molecules of iodine. Here it is, and release that iodine into the colloid. What happens next? Iodine attaches to tyrosine. If 3 molecules are attached, it will be T3. If 4 of them are attached to 2 tyrosines, that will be T4. So both molecules of T4 and T3 thyroid hormones are produced right here in their colloid. Later, they are taken in vesicles, it's called endocytoside, and combine those vesicles combine with lysosomes. Lysosomes remove all those particles that are not necessary from those molecules, and finally clean and nice molecules of thyroid hormone T3 and T4 are released into the bloodstream, and right now they are in the blood. That's how production process happens. When they are in the blood, they are transported through the blood by special proteins. If they were traveling alone, they would be destroyed very fast, so they need a carrier, and that carrier is called thyroxine-binding globulins, or TBGs. So both T3 and T4 bind to target cells receptors, and target cells for thyroid hormones would be most of our body cells. But T3 is 10 times more active than T4. That's why when they reach our tissues, peripheral tissues, very often T4 is converted to T3. Knowing their structures, you understand that it's only necessary to remove one iodine atom from T4 to convert it into T3. Now, how thyroid hormone production is regulated? Through negative feedback. It all depends on the concentration of those hormones in the blood. If thyroid hormones concentration in the blood is low, we don't have enough. Our hypothalamus produces TRH, thyrotropin releasing hormone. TRH goes to anterior pituitary, and pituitary releases TSH, thyroid stimulating hormone, which through the blood travels to the thyroid gland and stimulates it inside of its colloids to produce T3 and T4. Those hormones are carried to absolutely all cells of the body, and when they get into the cells, they activate mitochondria, they increase basal metabolic rate of body cells, and they increase body temperature. What is metabolic rate? It's a speed of all chemical reactions going on inside of the cell. So all the processes are going faster now. What happens if the level of T3 and T4 is too high? We don't need that either. Then elevated T3 and T4 levels go to our hypothalamus, and hypothalamus stops or slows down production of thyrotropin releasing hormone. As a consequence, production of thyroid-stimulating hormone in anterior pituitary stops, and thyroid gland slows down its production of T3 and T4. And that is your negative feedback mechanism of regulation. What are the functions of thyroid hormones? Major metabolic hormones. Again, they regulate speed of all chemical reactions, which is metabolic rate, and also they are responsible for heat production. It is called calorogenic effect. They also play a role in maintenance of blood pressure. People who have high level of thyroid hormones also very often have high blood pressure. Those hormones regulate tissue growth. They take part in development of skeletal system, nervous system in babies and in fetus, and they also can influence our reproductive capabilities. The thyroid hormone cannot be produced without iodine. Remember that dietary iodide, dietary it means we receive it with food. It gets from the blood into their thyroid cells, follicular cells, and then it goes to the lumen, to the colloid, and takes part in formation of the thyroid hormones. So deficiency of dietary iodine results in the impaired ability to synthesize T3 and T4. T3 and T4 do not go to the blood. It means their level in the blood will be low, and anterior pituitary gland starts producing thyroid stimulating hormone in large amounts. Thyroid stimulating hormone will hyperstimulate the thyroid gland, but thyroid gland cannot produce thyroid hormones, but it can produce thyroglobulin in large amounts. Thyroglobulin accumulates in those follicles. Follicles start growing in size, and it increases the overall size of the thyroid gland. Sometimes it's visible, and sometimes it can become really huge. That condition is called goiter. Fortunately, that condition is reversible, and if a patient starts receiving enough of dietary iodide in their food, they will be just fine. And what food is fortified with iodine? I just said it, it's salt. The table salt, most of it is fortified with iodine nowadays. Okay. What happens with the body when the level of thyroid hormones either is too high or too low? It's called hypothyroidism when the level of thyroid hormone is too low. It can be caused by Hashimoto's thyroiditis. It's an autoimmune disorder. It can be genetic condition. It can be also caused by low iodine diet, when the gland cannot produce hormones, exposure to radiation for cancer treatment, and certain medications also used to treat cancer and some other health problems also can cause hypothyroidism, and surgical removal of the thyroid gland can be the cause. Symptoms of hypothyroidism. Remember what thyroid hormones do. They speed up all the chemical reactions. In case of a lack of thyroid hormones, all the chemical reactions go slow. So patients with slow metabolism starts gaining weight even if they don't eat more than usual. They will experience fatigue because their cells cannot make enough of energies. Chemical reactions go slow. They can experience depression, hair loss, dry hair, dry skin because oil glands don't make enough of oil, muscle cramps, swelling of thyroid glands, that goiter we already said about. Their nails can become brittle. Their heart rate slows down and their blood pressure can go down too. They become very sensitive to cold and they feel cold all the time, but most likely they will be not only cold but also feel very tired all the time. And they can develop constipation because processes in the digestive system also go slow. Next one, hyperthyroidism. Too many of thyroid hormones in the blood. It can be caused by autoimmune condition called Graves' disease, also by swollen thyroid gland, and by nodules or tumors in the thyroid gland. You probably can predict symptoms of hyperthyroidism because when all metabolic processes, all chemical reactions go faster than usual, metabolism is fast, so patients start losing weight. Their nervous system is overstimulated, so they feel worried, anxious, sometimes shakiness. Sometimes their fingers will be trembling, and heartbeat will be racing. Their heart rate can go up to 120 and even higher than that. So the blood pressure will go up. Sweating spells. They will be feeling hot very frequently. The skin will be red and hot and itchy, and the bowel movement can be more frequent than usual, and they can start losing their hair also. Okay, we were talking about thyroid hormones. Now we are going to calcitonin. That is one more hormone produced by the thyroid gland. Remember those cells? They are called parafollicular cells. They are sitting between follicles and they produce calcitonin. Calcitonin decreases blood calcium level when it's high. So, right here, blood calcium level is high. Thyroid gland, those parafollicular cells, produce calcitonin. Calcitonin through the blood goes to our bones, and in the bones it is doing two things. First, it inhibits osteoclasts. Osteoclasts, remember that, are cells destroying bones, breaking bones and releasing calcium to the blood. So when osteoclasts stop doing it, the level of calcium in the blood goes down. Also, calcitonin can uptake calcium from the blood and incorporate it into bone matrix, which also decreases blood calcium level and helps to build bone tissue. So blood calcium level returns to normal level. Production of calcitonin by the thyroid gland is regulated by humoral negative feedback. Humoral, it means concentration of calcium in the blood. Before you continue, please stop the video and answer the questions for Chapter 17, Part 2.1. Now we are going to talk about parathyroid glands. Most of people have 4 parathyroid glands located at the posterior surface of the thyroid gland, right here. So that would be the left lobe, that's the right lobe, that's the posterior view, and you can see they are really tiny glands. But it's possible to have more than that, up to 8 tiny glands. Those glands, parathyroid ones, contain cells called chief cells, and chief cells secrete PTH, parathyroid hormone, that sometimes is called parathormone. PTH is the most important hormone in calcium homeostasis. So yes, it's more important than calcitonin. Okay, so parathyroid hormone elevates blood calcium level when it's low. You see, blood calcium level is low. That causes parathyroid glands to produce more of parathyroid hormone. Parathyroid hormone goes to its target organs. That would be bones, and that's where it stimulates osteoclasts to digest bone matrix and release calcium to the blood. Also kidneys. Parathyroid hormone increases reabsorption of calcium by kidneys, which means we stop losing calcium with the urine. And finally, also kidneys, it promotes activation of vitamin D, and vitamin D can increase absorption of calcium in our intestines, absorption from the food that we consume. So we should eat food rich with calcium. And all that mechanism is controlled by negative feedback. Homeostatic imbalances of parathyroid hormones. When the level of parathyroid hormone is too high, which usually happens due to the tumor of parathyroid glands, bones lose calcium and they become soft and sometimes deform. Very high level of calcium can depress our nervous system and also contributes to formation of calcium kidney stones. Hypoparathyroidism. Very low level of thyroid hormone actually is dangerous for life. It can happen in case of trauma or removal of parathyroid glands, which sometimes happens when surgeons remove the thyroid gland. And it can result in tetany, respiratory paralysis, and death. Why? Remember that calcium takes part in muscle contraction. If there is not enough calcium in the blood, then our diaphragm won't be able to contract and relax properly. Next glands would be adrenal glands that are also called suprarenal because they are sitting on the tops of the kidneys. So those would be paired glands. There are two of them. They have such a pyramid shape, and structurally and functionally it's not one gland but more like two glands in one. The central portion of those glands, which is called medulla, is made of a nervous tissue, and it's a part of our sympathetic nervous system. The outer layer, which is called cortex, is made of glandular tissue, and it's capable to secrete several types of hormones. Starting from the outside, going from outside to the medulla, there will be three main layers in the adrenal cortex. The very outer layer is called zona glomerulosa. It produces hormones called mineralocorticoids, and the main of them is aldosterone, the one that you need to know. Next one would be zona fasciculata. It produces glucocorticoids, and the cortisol will be the main hormone. And finally, the next layer, zona reticularis, produces androgens like dihydroepiandrosterone. We are starting from the outer zone producing mineralocorticoids like aldosterone, and main function of those hormones, they regulate amount of sodium and potassium in extracellular fluid. Remember what extracellular fluid is? That's the fluid that is located everywhere outside of the cells, between the cells, in the blood, cerebrospinal fluid, and so on. Sodium changes blood volume, which also helps to regulate blood pressure. Potassium takes part in membrane potential, especially resting membrane potential, so it helps to transfer signals through the nervous cells. The main hormone, the main mineralocorticoid, is aldosterone, and it stimulates reabsorption of sodium and water retention by the kidneys. It means water stays in the body. When water stays in the body, that increases volume of blood. What happens with blood pressure? Blood pressure increases. Before you continue, please stop the video and answer the questions for part 2.2. The second layer of adrenal cortex, which is called zona fasciculata, produces glucocorticoids. The most well-known hormone would be cortisol. And that hormone is released in response to adrenocorticotropin hormone, patterns of eating and activity and stress. So that is one of the stress hormones. One of its main effects is gluconeogenesis. It's when glucose, which our cells use for energy, is produced from fats and proteins, not just received with food as usually. Also, cortisol promotes rises in blood glucose level, fatty acids, and amino acids. One of very important functions of cortisol is that it inhibits inflammation. So cortisol and different medicines based on it are used as medications. Cortisone injections, for example, are given into inflamed joints. Prednisone tablets, an inhaler based on steroids used to manage severe asthma, and a lot of different diseases where inflammation persists can be managed with help of corticosteroids. Is it good or not? Well, Too high level of steroid hormones can cause hypersecretion or Cushing syndrome. Cushing syndrome shows up when adrenal gland produces too much of those hormones, hypersecretion, or when a patient suffering from some type of inflammation has to take steroid hormones on regular basis for a long period of time. What happens? It depresses cartilage and bone formation, which is especially dangerous in children. Yes, it inhibits inflammation, but at the same time, it depresses the immune system, which increases risk of infections. And also, it causes some changes, not very good ones, in different organ systems. Hypersecretion of glucocorticoids is called Addison disease, and it decreases glucose and sodium levels, which causes dehydration, which leads to low blood pressure and weight loss. But let's go back to high level hypersecretion of steroid hormones. Here are the symptoms of Cushing syndrome. First of all, it changes appearance. Moon face. Fat deposits will be on the face, on their shoulders and trunk and back of shoulders, but arms and legs stay thin extremities. It also causes changes of personality, irritability, sometimes can cause depression. It can cause changes in males and females' reproductive systems. It makes skin thin, causes striae, easy bruising, and osteoporosis that can lead to breaking easily, fractures of the bones. Next layer of adrenal glands, zona reticularis, produces sex hormones or gonadocorticoids. Usually, sex hormones are produced in testes in males and ovaries in females, but that layer of adrenal glands is capable to produce some amount of sex hormones. In males, those would be androgens, like testosterone. In females, those would be estrogens. And they may contribute to onset, start of puberty, and development of secondary sex characteristics and sex drive. Adrenal medulla is a central part of the adrenal glands where there are neural cells. And those neural cells produce epinephrine and norepinephrine. They have very similar structure and same function. Those two are stress hormones, and they are usually released during stress, fight or flight response, when we are supposed to fight for our lives or to run away. So the heart starts beating faster, increasing blood pressure, blood vessels constrict, except those going to skeletal muscles. Skeletal muscles receive more blood, and with blood they receive more oxygen. And to get that oxygen, our bronchi dilate, and blood glucose levels rise to deliver energy, fuel to cells. So skeletal muscles that receive oxygen and glucose could make a lot of energy and work for a long period of time. Pineal gland is located posterior and inferior to the thalamus. Here it is. It's a relatively small gland, and it produces one hormone called melatonin. Melatonin can affect the timing of sexual maturation and onset of puberty, but in adults it regulates circadian rhythms, day and night cycles. How it works: when it becomes dark and our eyes sense it, the signal goes to pineal gland, and pineal gland starts producing melatonin, so we feel sleepy during the dark time of the day. When it's light, production of melatonin stops. Melatonin also can influence some physiological processes like body temperature and appetite. Gonadal and placental hormones. In males, testes produce testosterone that is responsible for maturation of male reproductive organs, appearance of male, which is secondary sexual characteristics, sex drive. It's necessary for sperm production, and also it may help to maintain reproductive organs in the functional state. In females, ovaries produce estrogens and progesterone, and together those two hormones are responsible for maturation of female reproductive organs, female secondary sexual characteristics, and development of breasts and changes, cyclic monthly changes in the uterus. During the pregnancy, placenta secretes estrogens, progesterone, and a special pregnancy hormone, human chorionic gonadotropin. In details, all those gonadal and placental hormones will be discussed when we are doing reproductive system chapters. Before you continue, please remember to answer the questions for part 2.3. Our next endocrine gland is pancreas. Pancreas is a pretty large organ which is located inferior and posterior to the stomach. Stomach would be approximately right here, so pancreas is under it and behind it. Pancreas has triangular shape, that would be head of a pancreas, body, and a tail of a pancreas, which is sitting next to the spleen. And pancreas is an interesting organ, which is not just endocrine gland, but also exocrine gland at the same time. There are special exocrine glands inside of the pancreas. They have acinar cells, and those cells secrete digestive enzymes. Digestive enzymes are collected into the duct. Remember the difference between endocrine and exocrine glands. And those ducts carry digestive enzymes and release them into their duodenum, part of the small intestine, where they take part in digestion of our food. At the same time, pancreas has tiny structures called pancreatic islets or Langerhans islets. Each of those islets, and that's how they look under the microscope, contain endocrine cells. Alpha-type cells produce hormone called glucagon, and it's called hyperglycemic hormone. Beta cells produce insulin, which is a hypoglycemic hormone. Both of them together regulate amount of glucose in our blood. Now please remember what glucose is for. All of our cells need glucose. They take it, they also take oxygen, they also receive from the blood, and through the reaction of cellular respiration, they produce energy that is vital for their activities and the very existence. So let's start from glucagon. Glucagon produced in alpha cells, its target organ, major target organ, will be liver. In the liver, it's doing glycogenolysis. What is glycogenolysis? Breakdown of a glycogen to glucose. Let's remember, each of those is a glucose molecule. Those are monosaccharides. When they are connected into the long chains, branching chains, that would be your polysaccharide called glycogen, and that glycogen is stored in the liver. And anytime it can be broken into single glucose molecules, those can be released into the blood and increase amount of glucose in the blood. That process is called glycogenolysis, and it's controlled by glucagon. Another function of glucagon, it can promote synthesis of glucose from lactic acid and other non-carbs, which would be proteins or lipids. And glucagon also promotes a release of glucose from the liver to the blood to increase blood glucose level. So, main function of glucagon is to increase blood glucose level. Insulin has an opposite effect. Produced in beta cells of pancreatic islets of their pancreas, it lowers blood glucose level. Technically, insulin for our cells works like a key. It opens our cells' special protein receptors, and those protein receptors, after that, they can take inside glucose molecules. Without insulin, transport of glucose from the blood into the cells is impossible. And when insulin is released into the blood, it opens the cells and blood glucose goes from the blood to the cells, which lowers blood glucose level. Okay, also insulin participates in neuronal development, learning, memory, and inhibits those processes of glucagon, glycogenolysis and gluconeogenesis. How exactly it happens? Let's look at picture 17.19. So let's say somebody is checking their blood sugar level, glucose level, and normal amount would be approximately 90 milligrams of glucose in 1 deciliter of blood. What happens right after the meal, especially when you consume carbs? Your blood sugar level goes up, and that is called hyperglycemia, elevated blood glucose. Our pancreas, those beta cells, immediately produce insulin. Insulin goes to the cells and triggers them to take up glucose, which will be used to make energy in a process of cellular respiration. Also, insulin stops glycogenolysis. It means that glucose will be removed from the blood, goes to the liver, and built into glycogen molecules for storage. Also, insulin inhibits gluconeogenesis, so glucose is not made out of amino acids and fats anymore for a while. As a result of those three processes, blood glucose concentration decreases and returns to normal. Time passes and now you are hungry. Your blood glucose level goes down, which is not good. Your cells can be starving. If food is not available right now, then pancreatic islets, alpha cells, start producing glucagon. Glucagon acts on its target organs. Liver, glycogen in the liver is broken into glucose molecules, and those glucose molecules go into the blood, released into the blood, and increase blood glucose level. Also, glucagon stimulates amino acids and free glycerol fats to be converted to glucose. And one more effect of glucagon, it inhibits body cells from taking up glucose from the blood. As a result, blood glucose concentration increases. So both insulin and glucagon regulate our blood sugar level. Homeostatic imbalances of insulin. The well-known disease is diabetes mellitus, which is well spread nowadays, unfortunately. There are two types of diabetes, and we will be talking about diabetes during our lab type lab time discussing two types of it, diabetes type 1, diabetes type 2. Right now, you need to memorize 3 cardinal signs of diabetes mellitus. That would be polyuria, huge urine output. Why it happens? Because when there is sugar in the urine, that increases amount of urine. Next one. A lot of urine is produced, the body is dehydrated, that causes polydipsia, excessive thirst. The person starts drinking a lot. And finally, polyphagia, excessive hunger and food consumption. Why? Because in absence or lack of insulin, cells are starving. They cannot take glucose out of the blood. Another condition is called hyperinsulinism. It can happen in case of a tumor, for example. Excessive insulin secretion results in hypoglycemia, low level of glucose in the blood, disorientation, and even can cause unconsciousness. Other organs. Their primary function is not being endocrine glands, but they still can produce some hormones. First of all, heart. When our blood pressure is high, that makes our heart to work harder. And our heart cells located in the heart atria starts producing atrial natriuretic peptide or ANP, which can reduce blood pressure and blood volume. Inside of our stomach, and other gastrointestinal organs, some hormones can be produced also. Examples would be gastrin, secretin, cholecystokinin. Other examples of organs with secondary endocrine functions would be kidneys, producing erythropoietin for production of red blood cells, renin. Our skin produces cholecalciferol, the precursor of vitamin D, and even our adipose tissue can produce leptin that stimulates increased energy expenditure. Please remember to answer the questions for part 2.4.